Good day, everyone. I would like to welcome you to this episode of the podcast. And today's topic is going to be 64 years of independence, the Nigerian medical system, then and now, healthcare revolution. So, this is the part one of this episode, as it's going to be a kind of long episode. So, I like to cut it into different parts. So, Nigeria's 64 years of independence represents a complex journey marked by progress, challenges, and resilience. From gaining freedom from colonial rule in 1960, Nigeria has grown into Africa's most populous nation, rich in culture, resources, and talent. Over the decades, the country has been strides in education, healthcare, and technology, while grappling with economic instability, political struggles, and security concerns. The healthcare system in particular reflects the duality of achievement and ongoing challenges. While Nigeria has produced world-class medical professionals and expanded its healthcare infrastructure, the system continues to face issues like inadequate funding, brain drain, and unequal access to care. As the country moves forward, there is hope that with proper reform, investments in human capital, and greater unity, Nigeria can overcome its obstacles and fulfill its immense potential, especially in the health sector, ensuring that future generations thrive in a healthier, more equitable society. Ladies and gentlemen, this episode matters because it highlights the journey of Nigeria's healthcare system over the past 64 years, reflecting on both its achievements and persistent challenges. As the country continues to evolve, understanding the state of our medical system is crucial for shaping policies, improving public health, and ensuring access to quality care for all Nigerians. By reflecting on the past and looking ahead to the future, we can inspire meaningful conversations about the changes needed to build a stronger, more resilient healthcare system. Now, in this podcast, we will explore key areas of Nigeria's healthcare journey, starting from pre-independence era, the state of healthcare under colonial rule and early medical institutions, post-independence developments, efforts to expand healthcare access and build infrastructure, major milestones, growth in medical education, public health campaigns, and the establishment of teaching hospitals. Challenges faced, issues like brain drain, underfunding, and rural-urban healthcare disparities, impact of global health crisis, Nigeria's response to COVID-19 and past epidemics, future prospects, innovations in healthcare, digital health, and reversing brain drain. This journey highlights both the achievements and challenges in the Nigerian medical system. So let's dive into state of healthcare in Nigeria during colonial rule, setting the stage for understanding how far we have come since then. Healthcare under colonial rule before independence. Nigeria's healthcare system was rudimentary, serving mostly colonial officers and settlers with limited access for the indigenous population. The British colonial administration established healthcare primarily in urban areas, creating stark inequalities between urban and rural communities. In 1860, Nigeria's first hospital, Sacred Heart Hospital, was founded in Abeokuta by Roman Catholic missionaries. The date might not be really specific, but it's a range. And from the sources that we got, searching the internet and reading different articles, the most appropriate is 1860. Its establishment was a pivotal moment in the introduction of Western medicine to Nigeria, but it was accessible only to a few. Fast forward to the early 20th century, As the colonial administration began to expand its healthcare reach in 1927, Nigeria saw the founding of Yaba Medical College in Lagos, the first higher institution dedicated to training medical personnel. This marked the formal beginning of medical education in Nigeria, aiming to produce locally trained professionals who could address the healthcare needs of the growing population. During this period, healthcare was mostly curative with little emphasis on preventive measures or public health. British officials focused on protecting their own workforce, leaving indigenous communities vulnerable to diseases like malaria, smallpox, and leprosy. Now, we are talking about malaria also here, and still Nigeria is still battling malaria. You can see how much the country is still backward. The colonial government built hospitals such as Lagos General Hospital, which was established in 1893. But these were mainly intended for Europeans and urban elites, which is still almost the same thing today. As the colonial government realized the need to control diseases threatening economic productivity, initiatives like the West African Medical Service were introduced, primarily to curb the spread of infectious diseases and improve public health measures. However, healthcare remained limited and uneven, with large parts of the population, especially in rural areas, lacking access to any form of modern medical services. This is still the same issue that every doctor is still crying on still today. So under colonial rule, healthcare was exclusionary, urban-centric, and largely focused on maintaining the productivity of the colonial workforce. Indigenous Nigerians were left with limited access, which is why after independence, there was a need to restructure and expand the healthcare system to serve the broader population. This context paints a vivid picture of the challenges Nigeria faced at independence, and it also provides insights into why healthcare development was such a priority in the years that followed. Healthcare at independence, talking about 1960. At the time of independence, Nigeria inherited a healthcare system that was largely inadequate for its population. Medical facilities were concentrated in urban centers, leaving rural areas vastly underserved. Most hospitals were established by missionaries or colonial administrators, and there was limited infrastructure to cater to the growing healthcare demands of the nation. Challenges and limited accesses. Nigeria faced shortage of trained healthcare professionals, and this is the same thing that we are still crying all till date, with very few medical schools and hospitals. The majority of healthcare workers were expatriates, and the country's medical resources were stretched thin. Access to healthcare was primarily available to those in major cities, while rural communities struggled with limited or no access to basic medical care. Preventable diseases like malaria, tuberculosis, and polio were rampant due to inadequate public health infrastructure and limited immunization programs. This left the newly independent nation with the enormous task of building a more inclusive and accessible healthcare system, a challenge that would shape the direction of its health policies for decades. Now let's talk about post-independence efforts, talking about from 1960s to 1970s. Following independence, Nigeria's early government made significant efforts to expand healthcare access across the country, recognizing the need to address the rural-urban disparity in Nigeria. This government prioritized the development of more hospitals and health centers, particularly in underserved areas. The establishment of more medical schools was also seen as critical to training homegrown healthcare professionals and reducing reliance on foreign workers. The notable achievements are one of the most prominent achievements during this era was the establishment of the University College Hospital in Ibadan in 1957, which quickly became the foremost medical training institution in Nigeria. This facility not only improved access to specialized healthcare services but also played a key role in producing the country's first generation of locally trained doctors, nurses, and allied health workers. Introduction of policies for universal healthcare access. In the 1970s, Nigeria adopted policies aimed at providing universal healthcare access, particularly through the development of the primary healthcare services. This policy focused on preventive care, maternal and child health, and tackling communicable diseases. The government also launched initiatives to establish teaching hospitals in each region of the country, ensuring that healthcare services and medical education become more decentralized and accessible. These early post-independence efforts laid the groundwork for Nigeria's modern healthcare system, even as challenges in funding and infrastructure continued to persist, which is still almost the problem that we are still crying on till date. Growth in medical education. The post-independent period saw a significant expansion in medical education in Nigeria. The government recognized the need for a robust healthcare workforce and invested heavily in developing medical schools and universities. Institutions like the University of Lagos, established in 1962, and the Ahmadu Bello University in Zaria, established in 1962, became key centers for medical education and research, producing thousands of doctors, nurses, pharmacists, and allied health professionals. Expansion of the healthcare workforce. As medical schools grew in number, so did the healthcare workforce. The introduction of training programs for doctors, nurses, midwives, and other healthcare professionals helped fill the gaps left by the departure of expatriate workers. Post-independence. Over the years, Nigeria began producing its own specialists in various medical fields, contributing to a more self-sufficient and capable healthcare system. This expansion in the workforce was crucial for improving access to healthcare services across the country, especially in previously underserved regions. Despite challenges, the growth in medical education and the development of local talent laid the foundation for Nigeria's ability to manage its own healthcare needs. The creation of teaching hospitals. The establishment of teaching hospitals in Nigeria played a pivotal role in shaping the healthcare system. These institutions became the cornerstone for both training healthcare professionals and providing specialized medical care. Teaching hospitals were established affiliated with major universities and served as centers for advanced medical education and clinical practice. This model allows medical students, nurses, and allied health professionals to receive hands-on training in a real-world healthcare environment. Training healthcare professionals. Teaching hospitals such as Lagos University Teaching Hospital, LUTH, Ahmadu Bello University Teaching Hospital, ABUTH, and University College Hospital, UCH, Ibadan, became critical for producing Nigeria's next generation of doctors, surgeons, and specialists. These institutions offered not only undergraduate training but also postgraduate residency programs, ensuring that Nigeria could train its own consultants in various specialties. They also provided continuous professional development for medical staff, ensuring that healthcare professionals remain up to date with the latest advancements in medicine, providing specialized care in addition to their role in education, teaching hospitals also function as referral centers for specialized care. Patients with complex or rare medical conditions were referred to these institutions, where advanced medical equipment and highly trained specialists were available. This dual function of training and specialized healthcare provision helped elevate the standard care in Nigeria, making teaching hospitals the go-to centers for cutting-edge medical treatment and research. Through the creation of teaching hospitals, Nigeria not only improved the quality of medical education but also provided its citizens with access to high-level medical care, contributing to the overall growth of the healthcare sector. So now let's talk about the notable public health campaigns. First, let's look at the polio eradication efforts. Nigeria's polio eradication campaign stands out as one of the country's major public health successes. After years of concerted efforts by the government and international organizations like the World Health Organization and UNICEF, Nigeria was declared polio-free in 2020. This was the result of extensive vaccination programs, improved surveillance, and community engagement, particularly in hard-to-reach areas in the northern regions. The successes of polio campaign is a testament to Nigeria's ability to mobilize resources and work with global partners to eliminate a debilitating disease. The second thing is malaria control, as malaria remains one of the leading causes of morbidity and mortality in Nigeria. Various campaigns have been launched to control its spread. These include rollback malaria, distribution of insecticide-treated nets, and indoor residual spraying. IRS, the government also made strides in improving access to artemisinin-based combination therapies (ACTs) for treating malaria. Despite these efforts, malaria control continues to be an ongoing battle, with both the government and international organizations investing in prevention and treatment strategies. And let's talk about immunization programs too in Nigeria. Over the decades, Nigeria has implemented broad immunization campaigns targeting diseases like measles, tuberculosis, diphtheria, tetanus, and hepatitis. The establishment of the Expanded Program on Immunization (EPI) in the 1970s helped increase immunization coverage, particularly amongst children. While there have been challenges, especially with vaccine hesitancy and logistical issues in rural areas, these programs have contributed significantly to reducing infant and child mortality. Impact of the National Health Insurance Scheme (NHIS) and primary healthcare development is another thing that Nigeria have also achieved. The NHIS, established in 2005, was designed to improve access to healthcare by reducing out-of-pocket expenses for Nigerians. While the scheme has yet to achieve universal coverage, it has been instrumental in making healthcare services more affordable for formal sector workers, civil servants, and more recently, informal sector workers. Through pilot community-based health insurance scheme, NHIS continues to be an important mechanism for improving financial access to healthcare in Nigeria. Next is the primary health care development. The focus on primary health care in the 1970s and 1980s aimed to bring healthcare closer to the grassroots level, ensuring that basic health services like immunization, maternal care, and diseases prevention were accessible to the population. The creation of the National Primary Healthcare Development Agency (NPHCDA) has been critical in coordinating and strengthening primary healthcare services across Nigeria. The goal of primary healthcare was to provide accessible, affordable, and comprehensive healthcare services at the community level, particularly in rural areas. Although challenges remain, PHC has played a pivotal role in improving maternal and child health outcomes and controlling communicable diseases in Nigeria. These public health campaigns have collectively helped address major health issues in Nigeria and reflect the country's ongoing efforts to improve health outcomes for its population. So we are going to stop here for the part 1 of the episode. And as you can see from the part 1, it is clear that Nigeria have been on an upscale level. It's been improving, but we have to wait to see to the end of the episode to know the true story of the country, if it's actually improving or not. Thank you, as I see you in the next one.